In terms of COVID, some of the reports discuss, of course, we know it's a viral illness. It's spread through the respiratory system. I wouldn't say it's a viral illness, but it's spread through the respiratory system. And not to get into too much medical lingo, what have we found that the way the virus affects the heart? What is the connection with the heart that can cause a patient to be either very ill or need hospitalization or succumbing to the virus? What is
So,
what? Is,
I'll break it down to and just put it as the cardiovascular system, and we'll add the brain into that system
Mhm.
because it's a part of the stroke realm. So they
Mhm.
can have some long-term impacts on the brain.
Mhm.
It can cause it affects by block or attaching to specific receptors on the brain, in the body, in the heart to get into the cells.
Mhm.
And when it gets into those cells, it causes an intense inflammation, just like the flu virus.
Mhm.
Like you get muscle aches, chills,
Mhm.
shortness of breath, things like that. And the way it impacts the brain, it can cause significant headaches. So those are some of the presenting symptoms that people will have as their first symptom,
Mhm.
severe headaches that they didn't have before, and post-COVID having headaches that may be residual.
Mhm.
The vasculature or the blood vessel tree,
Mhm.
right? If you have disease in one part of a tree, you have it everywhere else.
Mhm.
So what we found that in COVID, it's either the virus or the inflammation that the virus caused that causes clots in the vein, the arteries, the veins throughout the body. So if you want to go from the head to toe, you can have increased impact on stroke if you get a clot to the arteries going to the brain. If you go to the lungs, you can get what's called pulmonary embolus,
Mhm.
or blood clots in the lungs that restrict blood flow to the lungs. Or
Mhm.
you can get what's called a DVT, blood clots in the veins of the legs, which can break off and go to the lungs.
Mhm.
Recent studies looked at not only is it a virus that's causing inflammation, but it's the inflammation that's causing fiber and other particles to build up within the cells,
Mhm.
in the vessels, in the blood, in the arteries, and in the veins
Mhm.
themselves to cause medical conditions. In the heart, it can cause inflammation, what we call myocarditis
Mhm.
or pericarditis, or inflammation of the heart. And there's studies that look at MRIs of the heart even a month or two down the line, and you still can find inflammation post COVID. So the important thing is that's not being talked about as much is those people that have had COVID, younger patients, athletes, that all these basketball players that have had COVID. How do we follow them down the line now? What are the protocols? Heart Association is developing protocols for following patients who've had COVID, in particular athletes.
Mhm.
It's gonna be like COVID and athletics, right? So you can still have arrhythmias down the line because now the virus is still inflaming your heart.
Yes.
Arrhythmias you've seen on commercials, atrial fibrillation, people dying of sudden death.
Right.
So those are things that we still have to keep an eye on in the post-recovery
Period.
phase of coronavirus.
Yes. It's very interesting because I did have the sudden death of a very young uncle in his 50s. And in certain areas, we're not, checking for COVID. He certainly was in an age range where you could say, oh, that was a massive heart attack. But, going back through our family tree and the men and the history that we don't have sudden death and
Mhm.
of the men in our family, there's a large number. I said, one day I just looked over the history that was given to me that he was fine. I spoke to him every day. He ran up the stairs, collapsed, and died, right? Certainly it could have been a massive heart attack. But then I said, wait a minute, this uncle is in an area where COVID is rampant. They were not very serious about mask wearing.
Mhm.
And he had a delivery bread truck. And I said, that was COVID. I definitely should have been in a differential. But if and talk about the political aspects of where you are, if you're looking for the cases and trying to be curious about how this disease is affecting the population, they should have checked. Okay. But
Well,
mhm,
yeah, you would hope that someone that young that they did an autopsy.
right. Well, again, if you're in a smaller area, and then if you're in an area where, again, the curiosity is not there, you're not collecting certain data, which has been the
Right.
trouble that we're seeing with COVID. We haven't had enough exposure to the data and the characteristics of how it's presenting in certain communities around the nation. That information has not been widely disseminated so that we can work with the coroners or the epidemiologists in certain communities down to small communities to characterize the presentation so that people can be aware. So that, I mean, it was very sad and disturbing. And then I read again what you were talking about, and that is that there is the athlete that passes out, and of course they were recovering from a COVID infection.